Greetings, loved ones. Intimate partner violence, also referred to as domestic violence, involves physical, sexual, economic, or psychological harm by a current or former partner or spouse. The significant public health problem affects millions of people in the United States and around the world. 1 in 3 women worldwide will say that they have suffered violence. Over 1/4 of men in the U.S. have experienced domestic violence, which accounts for about 15% of all violent crime. Today we're going to talk about intimate partner violence and child trauma. So help us get these messages out. Please subscribe to our channel. Follow us on Facebook and Instagram and Twitter, and hit the like button and the notification bell. And please share these messages with others. You never know, you could save a life. So 1 in 3 female murder victims and 1 in 20 male murder victims are killed by intimate partners. Domestic violence results in significant physical and psychological consequences, increases in healthcare costs, and 8 million lost days of paid work each year among survivors. And children are often the hidden or silent victims. Some are directly injured, while others are frightened and helpless witnesses. So how many children are exposed to partner violence in the United States? In a national telephone survey, 1 in 15 children reported witnessing violence in the home between their parents. This survey likely underrepresents the experiences of young children ages 6 and younger. A recent analysis of data from 8,446 children ages 7 to 18 who received mental health services from programs in the National Child Traumatic Stress Network further highlighted the significance of the problem. This data revealed that child exposure to IPV was the most frequently occurring trauma in child's history. It was surpassed only by traumatic loss or bereavement, with 49% of the children sampled having been exposed to domestic violence. 30% of children exposed to domestic violence had their first exposure before the age of 2. An additional 26% had their first exposure between the ages of 2 through 7. So what are the consequences for children exposed to inter-partner violence? Children who are witnesses to violence between their parents are at an increased risk for becoming direct victims, with research showing considerable overlap between exposure to domestic violence and child physical abuse. Children exposed to IPV or domestic violence are often too young to describe what is happening or too frightened to speak about the abuse. This exposure can result in children perceiving that their home and their parents are unsafe. They may learn unhealthy norms about parenting, relationships, and the use of violence as a way to cope with stress or to exert authority. So instead of developing a healthy understanding about intimacy, the children may learn that violence is acceptable, which could carry over into their own adult relationships. The resulting trauma of these experiences has been both short-term and long-term effects on children's physical and psychological health. Recent research indicates that these children are affected in the domains of emotional, cognitive, and social functioning. Childhood exposure to violence is associated with poor school performance, specifically with lower grade point averages and more days missed in school. Childhood exposure to domestic violence also predicts poorer physical and emotional health, and has been associated with increased rates of asthma, failure to thrive, developmental delays, increased rates of traumatic stress, anxiety, and post-traumatic stress disorder. Very young children are particularly vulnerable to the psychological effects of domestic violence exposure, as the stress experienced may affect the child's developing brain, especially in the first 3 years of life. This, in turn, may affect the child's physiological development, including the stress response system and the ability to regulate emotions. In addition, very young children have not yet developed coping or survival skills to mitigate the impact. So how can we address the needs of children exposed to inter-partner violence or domestic violence? The first and possibly the most important task is to identify these children as early in life as possible. Young children under the age of 6 are disproportionately represented in the population of children exposed to domestic violence, and targeted resources are particularly needed for this at-risk population. Early intervention can help, while domestic violence can have lifelong negative consequences on developmental health, and effective strategies and interventions exist to help mitigate the impact of domestic violence on children. For example, programs that provide active parent support and education, along with child-focused services, are associated with increased resilience in children exposed to domestic violence. And other promising interventions for children and families exposed to interpartner violence or domestic violence include programs that address maternal mental health problems such as depression and PTSD. Legal intervention, evidence-based treatments, especially for young children, and screening in medical pediatric systems. Because domestic violence has a far-reaching and serious impact on children, families, and communities, as well as the nation's public health and economy, policymakers can play a critical role in addressing the needs of children exposed to domestic violence by supporting policies that do the following: that assist survivor parents and children to obtain and maintain safety, to support early intervention programs for very young children to help prevent the long-term impact and intergenerational transmissions of domestic violence, implement universal early and routine screenings for childhood exposure to violence in pediatric and other primary healthcare settings so you can identify and respond to the physical and mental health needs of these children early. Also, you could provide education to children in the schools and other settings on how to engage in and navigate healthy relationships. You can develop, disseminate, and support effective evidence-based trauma interventions that help children and parents recover from domestic violence. Provide training and support to children and family services providers, especially healthcare, education, early childhood, and court personnel on the issue of childhood exposure to domestic violence. Another program that could be done is to create partnerships between domestic violence service organizations and support for frontline providers to build capacity for identifying and assessing at-risk children and families. You need to recognize that perpetrators, so we need programs that recognize that aggressors are often parents who have ongoing contact with their children, and thus programs are needed to address safety concerns, engage aggressors in opportunities to understand the impact of their violence in relationships, and to provide education about the impact of violence on children. Authorized by Congress in 2000, the National Child Traumatic Stress Network, NCTSN, is a federally funded child mental health service initiative designed to raise the standard of care and increase access to services for traumatized children and their families across the United States. The broad mission of the NCTSN includes assessment, treatment, and intervention development, training, data analysis, program evaluation, policy analysis and education, systems change, and the integration of trauma-informed and evidence-based practices in all child-serving systems. The UCLA Duke University National Center for Child Traumatic Stress coordinates the work of the NCTSN, which is a national network of 116 funded grantees in 170 affiliate centers and members and hundreds of national and local partners. The NCTSN and its domestic violence work group have developed a variety of resources for professionals, policymakers, and the public. These resources include a webinar series to assist child-serving systems in understanding the facets of providing services and treatment to children who have been exposed to domestic violence. These educational offerings also provide guidance on effective collaboration with key child-serving systems, including medical and healthcare, juvenile justice, law enforcement, child welfare, education, and military family communities. The NCTSN 10 Fact Sheet Series, Children in Domestic Violence, assists caregivers in understanding how children may respond to domestic violence and how they can support them in feeling safe, valued, and developing personal strength. NCTSN resources about IPV can be accessed at the link which we're going to show you now. It will also be in the body of this video. According to the CDC, over half of all children in the world, that's 1 billion children ages 2 to 17, experience violence every year. So the question is not if you're going to encounter a victim of violence, The question before God is, what will you do when you do encounter them? You could be the person who saves a life. Micah 6:8 says, He has showed you, O man, what is good. And what does the Lord require of you? To do justice, love mercy, and walk humbly with your God. We are all called to be champions for justice. If you are suffering violence, reach out to someone today. If you find yourself in a dangerous situation, call 911 for help. If you know of a child or other person suffering violence, please tell the authorities. In our next episode, we're going to talk about recovery from childhood trauma. Until then, God bless you.